right, we are going to go ahead and get started, go over some housekeeping rules, and then we'll get into the presentation. I'm Janelle Kleiner. I'm a doctor of physical therapy at Centrality Wellness. We are a pelvic health physical therapy clinic in Connecticut. We are in Guilford and New Canaan. We do virtual and in person, and we treat pediatrics all the way through adults and all genders. Tonight, we are going to be talking about lichen sclerosus, and we have a great guest for us to talk all about it. And then we're going to talk about how it relates to pelvic health physical therapy. We are recording, just to let you know. That way we can send out an email tomorrow to the recording for people who weren't able to catch it. Housekeeping, if you could please stay muted throughout the presentation. We will each present, and then at the end, we'll have a time for questions. And if you have a questions during the presentation, just go ahead and send it in the chat, and we'll be sure to get to it. Okay. All right, so tonight we're going to be talking about lichen sclerosus. Like I mentioned, I'm Janelle Kleiner. I'm a doctor of physical therapy. I specialize in adults and pediatrics. I have training through the Harmon and Wallace in the pelvic health. I also have visceral manipulations and a certificate of functional nutrition. And tonight we're going to be hearing from Kathy, who is the host of the Lichen Sclerosus podcast and co-founder of the nonprofit Lichen Sclerosus Support Network. She's been educating and supporting vulva owners and educating people about lichen sclerosus, which is the rare skin condition, since February of 2020. She has a great passion for helping people and just educating and advocating for those who really need it. Our goals and objectives, we're going to talk about what is lichen sclerosus. We're going to talk about symptoms and treatments. We're going to talk about resources for everybody. We're going to talk about what is pelvic health therapy and how can it help somebody with lichen sclerosus. And then at the end, we'll have times for questions and answers. So I'm actually going to pass it over to Kathy, and she is going to take over and speak to you guys about lichen sclerosus.
Thank you. Thank you. So I have lichen sclerosus, and for the last 2 years, I have grown a network to empower and educate people with LS. And in this presentation, it's an overview of what LS is. So we can go way deeper, and if you want to know more, I'm going to give you some resources that you can use to do that at the end. So, what is LS? I think you're going to have to do this naturally. There we go. So what is LS? LS is a chronic progressive inflammatory condition. It thickens the skin to the point that it has no elasticity. It can affect anyone from children up to adults. But it disproportionately affects the vulval anal area. So that's the vulva and the anus and the perineum. Though it can affect the penis and other body parts as well. And although it's not definitive, most researchers and specialists believe that it's an autoimmune condition with a possible genetic or hormonal component. So a lot of people do end up getting diagnosed post-menopause because the research has said that this is a bimodal condition that mostly affects people, prepubescent girls and postmenopausal women. But we're finding that there is a whole group of reproductive age people in the middle that are going misdiagnosed, undiagnosed until they get to that postmenopausal stage. And so we are working with researchers and specialists to change that, because it literally can affect you at any age. So what lichen sclerosus is not It's not contagious. You cannot pass it on to anyone. You touch, kissing, anything. It's not sexually transmitted, and it is not an infection. Some of the symptoms of lichen sclerosus. So I like to break it down into 3 groups, common, severe, and secondary, because even though the secondary conditions aren't directly coming from the condition, they can be just as devastating as the symptoms that are caused by the condition. And there's a lot of symptoms here. What I want to tell you is that LS is very individualized. So someone can have 1, 2, or they can have none of these. There are people who have asymptomatic lichen sclerosus, and they only find out when they go to their provider and they're going for their regular check, and they get looked at, and there are physical signs, but they haven't had any symptoms. So let's talk about the common symptoms first. The most common symptom that you're going to hear about when you're talking about lichen sclerosus is itching and white waxy skin. You look up LS, they even used to call it the white spot disease. And what happens is the skin gets so full of inflammation that those color producing skin cells can no longer produce their pigment, and they turn white. And the skin gets stretched to capacity that it makes it look thin on the top, but the skin in the inside is very thick. And thick skin is itchy skin. So this itch is beyond anything you can think of. We've had a yeast infection before. It doesn't even compare. It's just so bad that people scratch while they're sleeping. They scratch holes into their underwear. It is relentless. Other symptoms are fissures, ulcers, lesions, blood blisters, and tearing. So remembering the skin is so inflamed that it no longer has any elasticity. So it's very easy for it to be torn, especially during sexual activity. And what we found is that during the reproductive ages, the number 1 symptom complaint is not actually itching, it's pain with sex. And that can come as tearing as part of that. Moving on to the severe symptoms, you can have labial resorption. So the labia minora can actually shrink back into the body. You can have using what is in medical terms called scarring. So your clitoral hood, the clitoral hood can fuse over the clitoris or onto the clitoris. The labia minora can fuse to the labia majora, or they can fuse to each other. The vaginal opening can can start to fuse closed from the 12 o'clock and the 6 o'clock until they meet in the middle. So there are lots of different ways that LS can change our anatomy. And of course, this can then channel into our secondary symptoms. Mental health issues are very, very much real and an issue within the LS community. You can imagine this can cause depression, isolation. You're constantly thinking about this condition, which causes fatigue. You're anxious about what's going to happen to your body, what's going to happen when you go to the doctor. Low self-esteem, loss of sleep, low libido. All of these are very common secondary issues with LS. Some of the secondary physical side effects are hypertonic pelvic floor muscles, burning, whether it's with pain or urinating. You can imagine you have all these fissures or cuts from scratching. The skin is not healthy. and you're gonna have pain and burning. You can also have constipation, urinary issues, buildup of scar tissue. So now that skin is hard and doesn't easily move. You can develop vaginismus, and you can also develop keratin pearls, which generally is built up behind the clitoral hood. That keratin pearls is really its smegma, which is oils and dead cells and from your body that harden into what's been described as like a piece of sand, and it gets stuck back there behind that loose little hood. And you can imagine if you ever had sand in your eye, how irritating and painful that is. Now imagine it in your clitoris that has over 10,000 nerves. It is very painful. So these secondary and primary issues can also lead to loss of relationships. There are many people who have lost relationships, marriages, because they can't have sex. They're no longer, they're the same person, their moods and behaviors have changed. They pull away and they isolate themselves. And unfortunately, there is a 3 to 7% chance, depending on what research you read, that you can develop into vulvar cancer. Now, most of those people have gone undiagnosed and untreated for decades. And so unfortunately, this is a condition that takes 5 to 15 years currently in order to be diagnosed due to lack of information and awareness, not only on the patient's part, but also on the provider's part, which we at Lichen Sclerosus Support Network are working on changing. Thankfully, LS can be managed. Unfortunately, there is no cure, but when caught early, it can be fairly easily managed. And when caught later, it can still be managed. It's just going to take some work. So the gold standard treatment currently is ultrapotent steroid. And there are different ones. Some people cannot use steroids, and there are secondary treatments such as topical calcineurin inhibitors. And then there are experimental treatments, which they are in the process of studying, and they've not been proven effective as of yet. And there's they're actually finishing up a new trial, which is looking promising on a new topical treatment. It's called a JAK inhibitor, which works differently than steroids, but will be more targeting. So we're really excited about that. And there's treatments for those secondary conditions too. So any kind of fusing, any kind of scarring, there are surgeries that can be done to unfuse those. I will say that most doctors will not do any kind of surgery for cosmetic reasons because there is a very high chance that you will refuse, especially if you are not staying consistent with your treatment. And then, of course, there is pelvic health physical therapy. We always recommend when you get a lichen sclerosus diagnosis, you have a pelvic health physical therapist on your team. They can work with scar tissue. They can work with the hypertonic pelvic floor muscles. And I'm sure Dr. Janelle is going to go into that even more, so I will not. And then, of course, there's, I didn't put on a slide, but there's therapy support. You want to make sure that you have a good support system on your team. One of the, we'll go to the next slide. The next one. Yeah. One of the hardest things with lichen sclerosus is finding a good provider who knows what they are doing. And so at LSSN, we have a referral-based provider directory. Doctors cannot get onto this list without a patient referring. So you can find that at lssupportnetwork.org/providers, or you can go to ishwish.org. And that organization is the international, okay, it's for women's sexual health. I know the last part, but they also have a provider directory, though they don't list their specialties. You can look and see who's in your area, and then you can give them a call and you can see if they have someone that you can go see. So that is the overview. We have a lot of resources, as you can see on our website at Lichen Sclerosus Support Network.org. You can have get a more in-depth overview at .org/LS, and we have blogs, videos. If you have LS, we have virtual support meetups every 2 weeks, and from September 29th to October 1st, we are having a summit, a mini summit on vulvar conditions that are rarely discussed. And of course, we're going to be talking about lichen sclerosus, but there are over 15 conditions that can affect your vulval vaginal area that you probably never heard of. And so I'm going to put the information in the comments. You can go check it out. And if you have LS, right now is a perfect time for you to get one of our passes, because as a bonus starting today, you get an additional 48 video replays from our past holistic healing summits. And so that has a lot of information on LS and how to live with LS from a whole body approach. I'll put all those in the chat for you. Thank you.
Perfect. Thank you so much, Kathy, for that helpful information. All right, we're going to kind of tie this together about pelvic floor therapy. We're going to start really brief about what is pelvic floor. If you've joined us for the first webinars, you're already familiar with this, so we'll just make it brief. Your pelvic floor is a group of 3 layers of muscles, ligaments, and connective tissue. They make a supportive sling from the base of the pelvis, from the pubic bone back to the hip bones and the tailbone. They support our organs, so the bladder, rectum, uterus, and prostate, and they also play an important role in the function of our bladder, bowel, and sexual function. They also provide stability for the pelvis, and they help maintain balance and posture, and they also are going to help maintain the intra-abdominal pressure and help regulate that. So how can physical therapy help with somebody with lichen sclerosus? So a lot of what we do is we're going to help manage the pain and symptoms that are associated with lichen sclerosus. And we'll kind of go into detail more on the next slide. By doing that, we're going to look at their musculoskeletal and myofascial systems. So that's the muscles, right? The pelvic floor muscles, the muscles of the hips, the back, the pelvis, the core, and then the myofascial system, which is a really important role in lichen sclerosus. It's that first kind of layer of connective tissue that goes over all of our muscles. We're also going to address bladder, bowel, and sexual dysfunction. We want to make sure that the bladder and bowel are optimized to their best ability, and we also tend to see a lot of sexual dysfunction in people with LS. We're going to talk about nervous system involvement, and we're also going to treat the body as a whole. We want to make sure that we address all the impairments and symptoms. Some of the impairments that we see typically with lichen sclerosus is we often see adhesions around the clitoris, vulva, or perineal body. We also see dyspareunia, which is painful sex or the inability to have sex because of the adhesions. We usually find areas of muscle tightness and pain around the pelvic floor, abdomen, and back. And then we're going to see some sort of pelvic floor muscle dysfunction, whether that's hypertonicity, which is a tightness in the pelvic floor muscles, which is what we tend to see. We also can see some weakness and the inability to completely relax. And we also see quite a bit of bladder and bowel dysfunction. So musculoskeletal, what we're going to address with that is addressing the myofascial trigger point release and manual therapy. So this is a lot of working on the scar tissue. With lichen sclerosus and physical therapy, we aren't able to remove the scar tissue. What we do is work on the scar tissue and make it mobile. So a lot of times with scar tissue, it adheses to the tissue below it, and it makes some restrictions of movement. And so what we do is we go in and we can work with this scar tissue. We try to mobilize it and make it more flexible, pliable. And then we also can do this if it's related to painful sex. We can use tools that patients can utilize, like a dilator or wand. We're going to address the muscles around the pelvis, hips, back, and abdomen. So that is internal and external. Not only can the internal muscles be tight, but we see a lot of tightness, usually surrounding like the backs and the pelvis. And like I said, we're going to give them education on tools to help manage these symptoms, because they're going to come see us, weekly or every other week, and we're going to give them the tools to manage some of these symptoms at home. And we're also going to address their posture and their biomechanics and their ADLs. Ultimately, we want them to be able to, function in their day-to-day life as best as they can. With bladder, bowel, and sexual dysfunction. So like I mentioned, we want to optimize the bladder and bowel health. Now, sometimes with the scar tissue and adhesions, we're seeing constipation, or we're seeing some problems with the bladder and bowel. So optimizing these through like behavior and lifestyle modifications, but we also work a lot of the fascial restrictions around the bladder and bowels. We always want to create like healthy bladder and bowel habits and routines. And we're also going to address any dysfunction and pain, like I said, constipation, overactive bladder, anything that's going on with these organs, as well as optimizing pressure regulation within core. And then regarding sexual function, like I said, with patients with LS, we see a lot of dysfunction in this area because of usually where the adhesions are. If you have a clitoral hood fusion, that's really going to limit your ability to have sex. So that's where we're really going to work on that scar tissue. And we're also going to utilize tools like a dilator, anything that we can to kind of make a person's sexual life and health much better. Nervous system, a lot of times we can see an upregulated nervous system, and that can really play a big role in the hypertonicity of the pelvic floor muscles. So with tension and stress and anxiety, we tend to see tightness in the pelvic floor muscles, and this kind of goes hand in hand with some of the secondary symptoms of lichen sclerosus. So we do a lot of visceral manipulation, which is where you address the fascial tissue surrounding the organs. And sometimes what happens is this organ gets constricted, the fascia gets restricted and limits the movement of the organs. So specifically like bladder, rectum, a lot of the abdominal and pelvic cavity organs, we will usually work on that viscerally. We also work a lot with diaphragmatic breathing, which is going to downregulate the nervous system. That also helps manage the pressure within the abdominal cavity. And we're also going to build some positive self-care strategies and just make it possible for them to manage and handle the pain at home. When to seek PT for lichen sclerosus. When you're experiencing any pain in the pelvis, back, or abdomen, especially when it starts to interfere with daily life, and when you start to notice any dysfunction with bladder, bowel, sexual health. Sometimes we actually get patients, we've had a couple of patients who didn't know they had LS, and they come to us because they're having sexual dysfunction, or they started to notice pelvic pain. And sometimes we get them when they're just newly diagnosed. So it's really important as a pelvic PT to be aware of what does this look like, and when do I need to refer, and to have those referrals to be able to send to people. We have a really great support network, and just being able to connect people with the right, OBGYN who's familiar with LS, or the right dermatologist, and all the right providers, because really, this is a condition where you really want to have a team to support you. That's going to be the best. So anytime you start to notice any sexual dysfunction, tightness in the pelvic floor, back pain, hip pain, or bladder, bowel, and sexual function, you'll want to get checked out by a PT. What to expect with your first session. So the first session is really like a very in-depth conversation where we get into all the nitty-gritty about how your bladder and bowels are functioning, your sexual health, have you tried PT, what's worked, what hasn't worked. We go over all of your history, medical history, and we're going to do an evaluation of your hips, back, and abdomen. We're going to explain what your pelvic floor is and the pelvic anatomy. And then we can do an internal pelvic exam. Now, this is optional, and if you're not comfortable with it, we absolutely don't have to do it. What an internal pelvic exam is going to do, it's going to give us a really good idea of what's happening with the muscles internally, because the pelvic floor muscles are internal and we can't, see them, or it's very hard to feel them like a typical muscle. So it's going to give us an idea of, is there hypertonicity? Is there tightness and tenderness in these muscles? What's the strength of these muscles? What's the coordination of these muscles? How are they working with the rest of your body and your breath? We're also going to look at your strength as well as your mobility and flexibility. And the length and frequency can vary from person to person, depending on the severity of their symptoms, how fast they're progressing. I have patients who were diagnosed with LS. They got on the steroid cream, and their patches really diminished, and we saw great success. And I have other patients who, it takes a while of treatment to really go at it, and we really have to work. If the scar tissue is more advanced, we're going to work longer on those restrictions and adhesions. This is a great tool to find a pelvic floor PT. So these are 3 search engines. You can go to pelvicrehab.com. The APTA Pelvic Health is great. And then the Pelvic Guru. And they will have, just type in your zip code and find a practitioner. And these are people who have taken the pelvic floor courses. We're kind of concluding, and then we'll get to the questions in a second. But because you attended this webinar, we are going to offer a 10% off a 45 or 60-minute virtual or in-person consultation. So you can actually scan this code or use the code webinar, and you'll get the discount when you sign up for us. You also, like I said, we treat virtually as well as in person. We have a few more left this year. Next month, Dr. Sharon is going to be talking about vulvodynia and vaginismus. And then in November, we're talking about doula care and pelvic health. So thank you so much for attending. We hope you found this information really helpful. I know we have some questions in the chat. You can feel free to keep asking them if you have them, and we'll Kathy and I will both tackle the questions. Okay, the first one is there a right way to do a vulva check? Specifically, for lichen sclerosus, I would say, or just to make sure that your vulva is healthy. I would say that's a great question, because a lot of times women, are shy about checking out their private areas. So getting a mirror is going to be great, and looking, because, what is normal? What is your normal? Because every vulva looks different. So just, regularly checking to see, okay, do I notice any changes in this? And then kind of looking at the labia majora and minora, which are kind of the outer and inner lips of the vulva. You can definitely inspect the clitoris. Right underneath the clitoris and the clitoral hood is the urethra, which is great to look at. And then always the tissue between the vaginal and anal opening, which is the perineal body, because those can also have some changes, especially with lichen sclerosus. Kathy, would you say anything else?
Yes, actually, we have a lot of resources on our website for these in particular. So I left a link to a blog article that we have, actually might be later, on how to do vulva checks for LS. And then we also have a bundle that we have for sale on our website. We actually created 2 meditations that walk you through the vulva check process, because we understand it can be anxiety producing. It can, especially when you already have a vulvar condition. What am I going to see? What am I going to feel? How is this time going to be different than the last time? And so we created this. And so one is just a regular vulva check. And then the second one goes a little bit longer, and it's actually a pelvic floor vulva check. And it has music and it does walk you through. And there is also a PDF so that you can continue tracking your changes. And it walks you through in written form as well.
Oh, perfect. That's a great resource. Thank you, Kathy. Okay, the next question is, what can I do if my doctor downplays my symptoms and refuses to refer to pelvic PT or test me for lichen sclerosus? This is a great question. I would say, one, now you have the resources to kind of look, where can I find a provider that does lichen sclerosus and a pelvic floor PT? For as far as pelvic floor PT, you actually in most states don't need a referral, so you can come see us. And a lot of times, like I said, we have really great referrals for patients who have lichen sclerosus, and we can get you set up with those right providers. I would also say, find a new provider. If they're not going to advocate for you or hear what you have to say, you need to be comfortable with this person. And like I said, with lichen sclerosus, you need people that are going to be on your team, and you usually need a big team to treat this.
I also want to add, you can go to a gynecologist or a dermatologist. Lichen sclerosus sits kind of in between both. So if your gynecologist won't help you, and you have a dermatologist, reach out to them, or you have a resource where you can get a dermatologist definitely.
Yes, absolutely.
And the provider directory, I did link into the chat as well.
Oh, perfect. Thank you. Okay. Do we have to do an internal session on the first pelvic floor PT day? Great question. I kind of already mentioned we do not have to do it. We don't have to do it on the first day. We don't have to ever do it if somebody is just absolutely not comfortable or has, a history of trauma. There's a lot we can do. We can also just look externally as well without touching or doing an internal pelvic exam with lichen sclerosus. We can visually see oftentimes the patches and scar tissue. So if you are not comfortable with that, we'll absolutely work with you. And the first session is really about just kind of building a relationship with the patient, hearing their story, getting to know them, and just becoming comfortable with each other. What if I do not have a pelvic PT who understands lichen sclerosus near me? For this, I would say, first off, you can always see people virtually. So people like us who are familiar with it, you can see virtual for PT. You can always call and ask before you see them and say, ask the admin, do they treat lichen sclerosus? Do they have familiarity with this? Have they treated patients with this? Because we have patients call all the time and ask if we treat certain conditions that they may have that are more rare. And then again, I would look around, because you want to be treated by a PT who is familiar with this condition. Kathy, with your directory, do you talk about pelvic PTs as well? You have access to that?
Oh yeah, we love pelvic PT.
Perfect.
We do have some on our directory. We also have a full podcast episode, video, and a blog on pelvic health, physical therapy, and LS. And as part of that, we have a directory, and we also have a whole list of questions. We have a PDF, a list of questions that you can use when you're calling around to see if this PT can help you with your LS. Also, my PT are part of a larger network. But they're on the East Coast. So I'm gonna drop their link in the chat. But they are very much familiar with lichen sclerosus. It's very much part of their training, and they take insurance. So that might help a lot of people as well.
Yeah, that's great.
And I did put the link to that blog and video in the chat.
Okay, perfect. Thank you. Okay, what types of questions should I ask my providers to see if they are skilled in treating LS? That is a great question. Kathy, I'll let you kind of take this one.
Yeah, absolutely. So like I said, we do have that PDF. What you want to do is, first off, even if a PT doesn't know about LS right off, doesn't mean you should count them out. PTs are amazing people and they have great networks and they know how to find the information. And so even if they may not know, as long as they're open to learning and reaching out to their network and working with someone to learn, you should give them a try, because it's very much important that your relationship, your how you feel or with and how you feel about and with your PT is just as important as the work that they do. So you want to make sure you find someone that you trust and someone that tells you straight up, I don't know about this condition, but I'm willing to learn about it. That's a good person. I'd rather go to someone like that than someone that says, when then you go in there and here they are, and you end up with a tear or something like that. So vet people, call around. If they're not willing to take your phone call and answer some questions, they're probably not the right person for you. We have, like I said, I go to that link. We have a whole list of questions, some certifications that they probably should have, and just have a conversation with them. So yeah, I'll put them in the chat again.
Yeah, perfect. And is that, would you say that's the same thing as trying to find like an OB/GYN and a dermatologist for LS?
Absolutely, absolutely,
Yeah.
absolutely. It might be a little harder with the doctors getting past the receptionist.
Mhm.
You know, I find PTs have been the most gracious and kindest medical providers that I have dealt with. They're just really kind people. But yeah, you see if there's like with the doctor or you can even go to like some neurologists too. So gynecologists, urologists, dermatologists. Maybe if they can't talk to you, maybe you can send them an email. Try to get some feedback that way. But if you call in the receptionist, like what's Lichen Sclerosus, probably not good, probably not the best place to go to.
Yeah, absolutely. Okay. Then we had another question. Is there a link between autoimmune disease and lichen sclerosus? I think you touched on this briefly. It does have an inflammatory process, and I don't know that there's like a direct link, but they are thinking that it is autoimmune type related.
Yeah, so they did find these, and this is recent research, they found some proteins in the basement layer of the skin that when triggered causes an immune response. The immune system doesn't recognize this protein itself, and so it attacks it. And so that's that anti-inflammatory reaction. And the exciting thing is these new treatments that they're looking at are directly targeting these proteins. So if they can get these proteins to, calm down or shut off completely, stop emitting the signal, then we found potentially a cure. So it's exciting.
Yeah.
There's a lot of good research happening right now.
Yeah, and unfortunately, autoimmune tends to be more prevalent in women, which is what we see a lot with lichen sclerosus. Okay, another question we had is, my boyfriend has had LS since November of last year, and over time he seems to have developed CPPS. Is there a common link with LS, and is this commonly linked with LS for men? And what are the ways we can help men with LS and CPPS?
So I would say for my organization, we focused on vulvar LS. We do want to branch out to other types of LS, but we're new. We're very, very, very small team and limited capacity. So I don't know hardly anything about non-LS.
Yeah. Yeah, and I think we do treat males, and definitely we can help with the fascial restrictions and some of the typical things that we're seeing with LS. But I'm unsure of the link between CPPS really at this time. Okay. And I think that's all of the questions that we had for now. If you guys think of anything else, throw it our way. Like I said, we are going to send the recording out tomorrow, an email with all of these resources that Kathy has graciously shared with us, as well as the next free webinars that we'll be doing. As always, thank you guys so much for your time and spending the evening with us and learning about these important conditions related to pelvic health therapy.